Hi, this is Mnemonic Store, and today we're going to discuss concerning Huntington disease. This is a neurodegenerative disorder which is characterized by choreiform movements and progressive dementia. It's also an autosomal dominant disorder in which a child from a Huntington disease parent needs only a single allele to inherit the disease. And so, it should be noted that the chances of a kid to have Huntington disease is 50%. The most common symptom is jerky movements of the arms and legs, which we term them as chorea. Chorea usually starts as mild twitching and gradually increases over the years. Causes of Huntington disease. Well, this disease is caused by CAG trinucleotide repeat affecting the huntingtin gene on chromosome 4. In a normal individual, there are about 10 to 35 repeats in a row. But with Huntington disease, there is more than 36 repeats, which leads to formation of abnormal huntingtin protein that aggregates in the basal ganglia, specifically in the caudate and the putamen, which is collectively termed as dorsal-striatum. The aggregation of huntingtin protein causes overexcitation of the neuron and later leads to the death of nerves in this area. This loss of brain tissue causes the expansion of ventricles. Therefore, the neurotransmitter level in the brain shows elevated dopamine levels and reduced GABA and acetylcholine, which means in Huntington disease, inhibitory neurotransmitters are depleted in the brain, resulting to uncontrolled movement. Symptoms of Huntington disease. For easy understanding, we have classified them into groups, starting with physical, cognitive, and emotional symptoms. With physical symptoms, these include mild twitching of the fingers and the toes. There's lack of coordination and a tendency to knock things over. And also these patients suffer from walking difficulties and dance-like or jerky movement of the arms or legs, which is termed as chorea. With the cognitive symptoms, there's short-term memory loss and difficulty in concentration and making plans. In emotional symptoms, these people suffer from depression, which around 1/3 of the people with Huntington disease experience depression. There's behavioral problem, mood swings, apathy, and aggression. While researches are ongoing, there is no treatment for Huntington disease, which can slow or reverse progression of Huntington. But the current goal of clinical management is to relieve symptoms and optimize the quality of life. And therefore, with what I'm going to say, it's not actually treatments, but ways where we can relieve Huntington disease. We have pharmacological approach in which the drug tetrabenazine, a central-acting vesicular monoamine transporter 2 inhibitor, has shown positive effects in treatment of chorea for patients with Huntington disease. It selectively depletes central monoamines by reversibly binding to VMAT2, that is, the vesicular monoamine transporter 2, therefore reducing the release of dopamine so that it prevents uncontrolled movement or chorea. 2, to treat depression, selective serotonin reuptake inhibitors should be considered as the first-line therapy. Other antidepressants, including bupropion, venlafaxine, nefazodone, and tricyclic antidepressants, also can be used. Electroconvulsive therapy can be used in patients with refractory depression. As we sum up this, let's take to note that death within 10 to 20 years after diagnosis usually occurs due to aspiration pneumonia. Suicide is common due to depression, and there is also death due to falls. To my surprise, we also found that Ongoing researchers seek to treat this through surgical procedure, of which till now we don't know what's going to happen, but we are waiting for the surprise and hopefully it would work. Thank you for listening. Hopefully you found this video helpful. Many more are coming on the way, so just make sure you subscribe and press the ring bell never to miss any updates. Thank you.